My name's Julia Downing. I'm the Chief Executive of the International Children's Palliative Care Network, and I'm also a Professor in Palliative Care. So my background's in nursing. I'm a palliative care nurse, and currently with ICPCN we help to develop and promote children's palliative care around the world. I've been working in palliative care for over 30 years now, and quite a lot has changed in that time. When I first started working in palliative care, people didn't know what palliative care was. There wasn't much palliative care for children. In the UK, where I was working at that stage, people knew about palliative care for adults, but children's palliative care, there wasn't a lot. And in those 30 years, there's been a lot of development, certainly in the UK, and children's palliative care is a lot more established now in the UK. But in many other countries, and I work around the world, children's palliative care is still in its infancy. There's over 21 million children that need palliative care around the world, and only around 5% have access to that. So whilst children's palliative care in some countries is very well developed, in other countries it's non-existent, and there's children suffering needlessly around the world because they can't access palliative care services. Things are improving, and we're working with people across the world and with the World Health Organization and organisations such as Maruzza to ensure that children's palliative care continues to grow and develop. What advice would I give to a young health professional thinking about working with seriously ill children? Well, I would say go for it, but there's things that I would say to them about looking after themselves, about learning and developing their resilience. I would say to them that it is hard. It's hard at times, particularly looking after children who you've known for a long time who are then dying, or if you have a child of a similar age. You know, it is hard and it is emotional, but at the same time it's very rewarding. And to me, certainly as a nurse, the difference that I believe that we can make for children, their siblings, their families, makes it all worthwhile. So I would encourage people. I'd say it's rewarding, but I'd say they need to look after themselves. Well, I think that the Maruzza Congress is great. 10 years, I think it is now, since you started the Congress, and it's been really good to see some of the developments over the years. So that the range of people coming is broader. The number of people coming is broader. I think one of the exciting things of this one is, I know we haven't had a Congress because of the pandemic, but there's a lot of new people. There's a lot of people, I think there's about 40 from Norway, and there's lots from Italy, and there's a lot of younger people, new people to the field, and that's exciting because hopefully they can learn and they can see that they're not on their own, that they can share experiences and learn from others, and that will help develop the field. So for me, it's a good opportunity to hopefully inspire the new generation of children's palliative care people to network, to meet with colleagues and friends, and the value of the conference is immense, and I guess that's why I keep coming.